Good afternoon, everyone. Welcome back to my YouTube video channel. Follow my this video. You learn something. Check it out. Good afternoon, everyone. Welcome back to my YouTube video channel. Free dental education for dental hygienists, dental assistant, dentists, new dentists, experienced dentists. And feel free to give me feedback so I can improve my video. Just to be honest with you, I do this every day on and off. If I have time, I make the video better and more informative. But anyway, I want to go ahead and jump in right in to talk to you guys about the journey to get this 4 teeth crown done with under senior patient who have a lot of medical condition that require a quick procedure, a fast approach. So follow me and go with me here. Hey guys, let's jump right in. As you can see that this patient have the upper overdenture with a few implant on the top, and also tooth number 23, 24, 25, 26 have decay. Underneath the facial aspect of number 26 below the composite also show the recurrent decay. We are going to take the impression for a temporary crown. As you can see, you put quick body material. I was trying to put some wax underneath this those decay, and so that way I don't have an undercut by taking the impression like this. When you are not quickly respond to your procedure, you can see now you don't have a perfect impression. So what I have to do is put some relight material, which is the light body material, and this procedure will take a few minutes. I don't like to do this, but in case that I have to make a good temporary crown, I rather do it now. So I go ahead and relight this temporary material for the case to get ready for us to do a beautiful temporary crown for a patient. As you can see, it looks not too bad. You got some margin capturing. So now what I have to do is I have to think how fast should I do, what should I do, how I can approach it faster but efficiently. I would usually start with the incisor, reducing the height of the tooth, so you can have more access to mesodistally. And so the first thing, it will reduce the height of the tooth facially, lingually, and also, if possible, just go farther back to a little bit more midline of the tooth. So that's what I'm doing right now, is trying to reduce the height of the tooth. But before we even do that, we want to have the bite check and make sure how much room we need. Because we're in a denture, so there's a little room to reduce. So anyway, I started that. Now I have to go ahead and do the interproximal with the thin bird, so that's way we don't damage the adjacent tooth. After we remove those interproximal, we're going to end up having a little space to work with. Just notice that, when the water going to the senior patient, it's not very easy. The assistant have to be aware of it and make sure that there's no much water going on in the floor of the mouth. Otherwise, patient will have so much struggle with breathing and aspiration of stuff that we put on. So you guys at the assistant, keep an eye on that. And so now I'm going to go ahead and work on the lingual side of the backside. Anyway, we are done. We are taking an impression on the upper arch right now. This is the upper denture. As you can see, Medic 500 just update with me the new version of the software. The sound is different than you used to hear. So this is the music that I have right now. It's kind of cool. And so here we go. We scanning the upper arch, ready to finish the upper arch. Doesn't take long for scanning the teeth at all. So here we go. Finish the upper. Now we are doing the mandible. The beauty is once you scan, you can show the patient she have a broken tube on the bridge there. That's the implant that somebody done for her. So we can talk about that as well. So scanning the prep right there. My struggle that I have is because the patient don't have good dexterity to maintain her oral hygiene. So there is a lot of bleeding going on. I had to use I had to make sure the margin look okay, so I had to do the laser gingivectomy, reduce the margin around the gum area. That's where I can get the better margin of the prep before I do this. Now, my problem with the Medic right now with the software is I tried to take the bite registration, but I gotta get something going on that it didn't capture. It doesn't get me a clue with the bottom two. So what I have to do, I had to stop this right now, and I have to go back to the lower teeth and trying to scan more of the buccal aspect of the mandible to get the complete tissue. So after I do that, you're gonna see I hear a click, and this is it. That's the bite registration that I got from the total green line. Now we are cementing the temporary bridge, which is a tiny little bridge. They're very small teeth, very hard to make a perfect one. But I'm putting on. I'm not using anything fancy besides flowable composite. And don't put too much, guys. Just a little bit flowable composite, a little bit, no bonding, nothing like that. Just retention with the physical, mechanical retention. Polishing the patient up, check the bite, and she's almost done. And a couple of things that you learn from the today message is the medical machine. When you struggle with taking the bite, you have to go back to your model, either your upper or lower, rescan the facial again in order to get the better one. Thank you for watching, you guys. Have a great day. Bye bye.
Thank you for watching.